Oh, hi, I'm Kerry. I'm a dermatology registered nurse. I've been working in the industry of dermatology for 7 years. I've also been doing my cosmetic injectables for 7 years. I've a background in postgraduate studies in intensive care. I've worked in general nursing for over 25 years. I've also studied privately, doing an aesthetic course through a diploma of health science actually, and I majored in cosmetic injectables. I was one of the first people through doing that before they set up all these private courses that are now available. I was fortunate enough to be picked up by two of the pharmaceutical companies, and they took me on board and trained me up. I was actually sponsored for a couple of years prior to being an independent practitioner. I've always worked directly under Dr. Goodmanson, who's a dermatologist. And yeah, I love my job. I'm very passionate about the skin as a whole, not just injectables. I'm really keen to let people know the benefits of looking after your skin and protecting your skin from the sun, and good skincare regime, which can also help to enhance your results of your injectable treatments and help to make them last that little bit longer. I think that's about all I can tell you at the moment. I've got a couple of MediSpas running, which are quite successful. I'm injecting probably 20 to 25 clients a day, 5 to 6 days a week. And yeah, I'm open for any questions. Throw it at me. I've heard it all before. Maybe somebody can throw something at me that I don't know, in which case I would always refer back to my prescribing doctor, who is Dr. Goodmanson. He's here on site, so if I ever need to check anything, I can do that with him. Okay. So the first question that's come through is, there's so many fillers on the market. I'm confused as to what's what. Can you please give us a quick rundown on what's available here in Australia and how long each one lasts? Also, which fillers that I prefer and why. Okay, so in Australia, we've got 3 products that have been approved through the TGA. Brand names are Botox, which is made by Allergan, Dysport, which is made by Galderma, and Zeman, which is the latest one to the market, which is through a company called Merce. I've got a lot of experience with both Botox and Dysport. Basically, their mode of action is the same. You will achieve the same result from both. I don't have a preference for either. I like them all. I have preferences for which one I prefer to use in different areas. Certainly, the least amount of product that has to be injected to achieve a certain result is always a benefit for you, the patient. It makes it a much more comfortable experience. But as I said, depending on what area I'm treating, I have different preferences for which product. I don't have a lot of experience with the latest one to the market, Zeman. Just because it's new to the market, I've tended to just stick with the ones that I do know and the ones that have a lot of scientific evidence behind them, which is why I've stuck with those 2 for now. Each product tends to last. I can talk specifically more about your Dysport and your Botox. When we're treating a frown line, for example, you can expect that they'd last 3 to 4 months with your Botox and up to 5 months with your Dysport. So again, this is dependent on your muscles and how much you require with the treatment. I tend to start off with the recommended minimal dose, get you back in 2 weeks for a review, and at that time, if I need to, I can add more if needed. But generally, we get it right first go. The next question is about fillers. Okay, there's a number of fillers on the market, and the longevity of those products varies depending on which product that you use. We have fillers that are of a thinner consistency, which tend to last roughly 3 months. They're used more to hydrate the skin. Other fillers are a little bit thicker. Again, different products that we use in different areas. There's a number on the market. Your Juvederm range by Allergan, and also your Galderma products such as Restylane, which has been known for a long time in Australia. It's probably one of the longest used products in Australia. They've just introduced a new range of products called Amaville, slightly longer lasting and more natural, closer to your natural fats. I'm getting really nice results with that. All the ones that I've tried from both Allergan and Galderma give really nice results, and if the practitioner knows which product to use for a particular area, it ensures a better result for you. Okay, so, and how long do they last? Again, that depends on the product that we choose to use. So it can range anywhere from 3 months for your skin booster type of products, right through to 18 to 2 years with your Allergan range of products. Voluma lasts 18 months to 2 years. Your Amaville products haven't been around long enough for me to be able to personally say how long you'll get out of it, but generally between 12 and 18 months is a good time frame. Next question. I've seen some amazing results where people have had their lower eye bags filled. Is this true? Can it be done? And how long does it last? Yes, it can be done. The choice of product that you would use in this area is particularly important. But before injecting into the tear trough area, I always like to have a look at this area here. This is called a mallow fat pad, and generally we treat that prior to treating a tear trough. The reason for this is by correcting your tear trough, you can sometimes get a really sufficient result and a bit of a lift up through here, which makes the tear trough appear less noticeable. Certainly by having a tear trough treatment, you'd want to be with an experienced practitioner. We tend to use different techniques depending on the level of experience of the practitioner, and also what's appropriate for that particular person. But certainly you can treat the tear trough area. I'm just looking at, I've got a few questions coming through now. Is it true that fillers can leak through the face and cause things like blindness? Okay, so it doesn't necessarily leak through the face and cause blindness, but what it can do is push on some special nerves and arteries that run up through your face, and if injected incorrectly or too much or the wrong product, it can press up against a vessel, and if that occurs, it causes necrosis, which means dying off of that blood vessel, and certainly that has been proven in the past to have caused some sorry about that. Yes, it has been linked with blindness in the past, so it's really important that your practitioner knows how to treat any complications and have all the emergency equipment that they need on hand if that was to occur. Personally, I haven't seen it done, touch wood. It can happen, so just be aware of that. The next question is, why is some Botox places cheaper than others? Okay, that's a good one. Depending on the product that you purchase, some people advertise using different measurements of dose. So the biggest example I have of that is if we're treating a frown line, for example, the recommended dose for that is 20 units of Botox. So if somebody had a set price of, say, $10 a unit, that would cost you $200. In the case of a product like Dysport, you use 2.5 times more that product to equal one Botox unit. So some people advertise it at a lower rate, say $4 a unit or $3.95. You do have to bear in mind, if you're trying to equivalate that to a Botox dose, you need to times it by 2.5. So if somebody's advertising at $4 a unit, times it by 2.5, you're actually paying the same price, which is $10 a unit. They say that you shouldn't, the doses aren't equivalent, but that's the best way I can explain it to people so they understand the advertising techniques that are used out there to try and encourage people to come to them. But basically, price shouldn't be your main concern. Your main concern should be that you're with an experienced practitioner, and if you're happy with that practitioner and comfortable, and if it's going to cost you $5 cheaper down the road, would you risk it? I don't know. I would tend to stick with the the practitioner that can offer you the best service. It's not just about having an injection at your aftercare. It's having a doctor available on call if needed, if there's a problem, and certainly for any follow-up care. So you need to know that your nurse or doctor is available in 2 weeks' time, for example, to do your review or to correct any problems that may occur. So price is probably not what you should be looking at as your first point of call. How can I be sure I'm going to a good practitioner? Okay, certainly the area, the clinic in which they're working, certainly would give you a good idea whether there's a doctor in the clinic, whether they have emergency equipment available, how long have they been practicing, whether that be a nurse or a doctor. And certainly ask for before and after photos. You want to see their work and what they've done before. I think word of mouth is probably the best advertising out there, and if you're hearing a lot about a particular person, you can probably bet that you're in good hands. But go by the first gut feeling you have. If you're not happy and content with the person that you're having a consultation with, go somewhere else. And this is the last question that's come through. It says, hi, and thanks so much for taking my question. What does filler actually contain, and how safe is it to be injected into our bodies? Is there any long-term research done to prove its safety in long-term use? I like this one because I've just recently studied this as part of my ongoing training. So the filler contains hyaluronic acid. It's grown in a laboratory, the same as any other medication in Australia, and it's approved through the TGA. So all the products that are used in our clinic, certainly anything that I use is TGA approved. It's a natural sugar compound that's broken down into your body over a period of time. And as I said before, that depends on the longevity of the product. So generally it's in your system for 6 to 12 months, again, depending on the product that you've had. Long-term research, it has been done. And the only thing that I've come across in my own personal research is that there's never been an actual allergic reaction to the HA, which is the hyaluronic acid that's in the product. There has been one case that I'm aware of where there was an allergic reaction, and when it was tracked back, it was found to be a processing problem, so something that occurred in the laboratory that caused this reaction to occur. There's lots and lots of research out there. A lot of the drug companies such as Allergan, Galderma, Merce have lots of data and all that, and I'm happy to show that information to people who are particularly interested in research and the science behind the products that we're using. Now, I've got another question come through. Okay, what if you get lumps in your lips? Okay, so lumps can occur sometimes, again, depending on your product. I've seen some that have occurred more with some products than other products. It's a good idea to massage them. Certainly you want to be quite firm with your massaging and try and break it down. They can occur as a result of being too superficial. Sometimes they can just happen, so I think it's a good idea to return to your practitioner. Usually part of their aftercare, they would discuss all that with you. If it's a persistent lump that doesn't go away, there are some dissolving agents available that could be used to dissolve that product. So you've heard of the filler Lynch. Can it be removed if there's been too much in there? Okay, Lynch is not a product that I know. I'm not familiar with it. As I said, I've stuck to the products from Allergan and Galderma. I'll have a look into that and try and see if I can answer that question for you. And the question is if it can be removed. If it's a hyaluronic acid filler, yes, it can be removed. I'm not sure of the ingredients there, so I can't really answer that question, sorry. But I'll come back to it after I've done a little bit of research. Sammy's posted a question now. Is it possible to change the shape of your nose with injectables? Certainly, you can get some awesome results, particularly with the bridge of your nose here, and some people who have this pointing of the nose. There's certainly some treatment options available. This is an advanced technique, and again, I would be really looking for a practitioner who has lots of experience in that area. There is really great results that you can get with that. Okay, so Angela's posted, lumps post-injections. Okay, so Angela's asking about lumps in the lips post-injectables. I'm assuming you mean filler. And as I said, yes, you can massage it. Certainly return to your practitioner. If it's an ongoing problem, it can be dissolved. Okay, Sammy. Oh, thank you. Yep, that's great. Last question. Okay, does it help with skin elasticity, for example, excess skin under the chin? Okay, so excess skin is a surgical intervention. It's not something that's going to be fixed with filler, and I would certainly refer you to a plastic surgeon for that. It can help with the elasticity and the overall tone and texture of your skin, but excess skin, no, it's not going to. I would refer you on to a surgeon. Okay. Any more questions, anybody? Great. Okay. Thank you for joining us, and I hope I've answered all your questions sufficiently. I will get back to the question regarding a lance. Thank you and good night.